Hospital wait times and wait times for special treatment, screening, and diagnosis are an ongoing challenge in this province. Joining us now is Jason Sutherland, a professor at the UBC School of Population and Public Health. Jason, thanks for being here. You study developing ways to monitor and evaluate health system performance. How does your work target reducing hospital wait times, first of all?
Well, right now, hospital wait times for elective surgery are a critical issue for a hospital and the government to address. Wait times for surgery have been an important issue for well over 15 years, and it seems to be a problem that's really just stuck in the mud as successive governments and ministries of health have been unable to address it. It's not only a problem in British Columbia, but all over the provinces right now.
We're going to get to COVID in a minute, but what were some of the major backlogs that were creating that problem that you found before the pandemic?
Yeah, right now, there are some policies that governments and health authorities can implement to try to reduce wait times. So far, they have been ineffective at implementing the policies, and some of them include such as a triage system. So that means having a family doctor review all of the patients queuing up for an access to a surgeon to make sure that they really need that, or if they can be managed medically by their family doctor. Another approach is to have a centralized referral system, such that the surgeons with the shortest wait time see the next patients, rather than going for the one that the primary doctor is most familiar with.
Now, to COVID now, we know that it created a backlog of treatments of all kinds, among many other challenges. How bad did it delay treatments? Are you able to quantify it?
Yeah, definitely set back the wait time for many thousands of patients in British Columbia by many months. I think the government has worked hard with the surgeons and the hospitals to redress the patients that have waited the longest. And now we're back to wait times that are almost at the pre-pandemic wait. Although many system experts would still call the wait for elective wait times unacceptably long.
And in your experience, is there a general number, like how long people are waiting for those elective surgeries right now?
Well, certainly many thousands of patients are waiting 6 months and even some over a year. I think that it will take a concerted effort for hospitals and Ministry of Government funders to really get that down into the number of 2 to 3 months.
Now, we've heard some ideas from various political parties. The Green Party, for example, wants to have centralized care hubs where you essentially have a family doctor, but then specialists within that. What are some of the other proposals you've heard that you think might work?
Yeah, one of the things to do is try to remove care from the hospital, such as in outpatient care centers. And that'll move activity away from the hospital with primary care physicians located there, pharmacists located there, allied health such as physiotherapists and dietitians, but also physiotherapists there to provide a more integrated and wholesome approach to patient care while they wait.
Why do you think we haven't done it like that before?
Well, it's very expensive to set up, and it's very challenging from a health human resources perspective to go out and make new community healthcare centers. So I think that in the name of trying to save a little bit of money, we've really taken steps away from providing a much more modernized healthcare system, such as apparent in many other countries.
And lastly, we appreciate your time. When it comes to family doctors, we know they have a new contract with the province, paying them quite a bit more to recognize the administrative work that goes into what they do. How confident are you that that will allow more people to get access to a family doctor?
I think if it attracts more physicians to work longer hours or to return to the workforce, it might have a chance. I think keeping the number of primary care physicians the same and just paying them more might not give us the results that we need in terms of more access to primary care.
Jason Sutherland, you've given us a lot to think about. We appreciate your time. Jason Sutherland, a professor at the UBC School of Population and Public Health.